these are the things, right, that we do for foundational treatments, which I think both of us have similar kind of treatment styles where if there's an imbalance, then yes, we often do need some kind of targeted treatment, right, to correct that. Yeah. But our goal is never that we just put you on a bunch of protocols and you just take these things forever, right? It's more so trying to achieve that balance in the body and then allowing diet lifestyle to take over long term. Well, guys, thank you so much for joining this webinar with us. My name's Dr. Alexandra Smith. I'm a naturopath here at Nirvana Naturopathic Medicine, and my primary practice focus is women's health, and I work with a lot of gastrointestinal health concerns. So this topic is going to be really fun to discuss tonight for myself, and I'll let my colleague introduce herself here too.
And I'm Dr. Amy Morrison, and I'm also an MD at Nirvana. I primarily focus on a bit of digestion as well, like Dr. Smith, and then chronic inflammatory response. So a lot of the times when there's inflammation in the system, that can disrupt hormones and can disrupt the digestion. So we do see a lot of overlap with these two topics together in both of the areas that we work with. I think we were going to start with breaking down what the microbiome is, what gut health means, what hormones we're going to talk about when it comes to the cycle. So do you want to start with the menstrual cycle, female hormones, what that looks like?
Yeah, totally. Just before we dive into all of that, just so you guys are aware, we'll chat for about 45 minutes, and then depending on how many questions there are, we'll start to address those 45 minutes in. So if you have a question, feel free to drop it in the chat, and then we'll try to get through as many questions as we can at the end. And then there will be a recording of this webinar that's sent out at the end of this. So we'll get that sent over to you guys probably by tomorrow. So yeah, let's start by talking about hormones and gut health and what these things actually mean. So I'm going to start with the gut. A lot of things start in the gut because the gut is so important for our ability to absorb nutrients so that we can make the building blocks for our hormones. And then also super important for elimination of our hormones. So with the gastrointestinal tract, we often talk about something called the gut microbiome. This is a really hot topic right now. A lot of people are talking about this. But essentially what the gut microbiome is it's the environment of different organisms that are living in our gastrointestinal tract. There can be bacteria, which a lot of bacteria are beneficial for us, and we would consider those to be probiotics that we might see in supplement form. We can sometimes see bacteria that shouldn't be in the gastrointestinal tract and be considered overgrowths or different imbalances or infections. We'll sometimes see yeast in the gastrointestinal tract, and that can be a normal finding or an overgrowth, again, that needs to be treated. And then sometimes there are viruses or parasites. We all have our individual gut microbiome makeup, and the gut microbiome really helps us to break down our foods appropriately, to focus and support immune system regulation in the gastrointestinal tract, so that as we break those foods down, we absorb them properly and we absorb the different nutrients that are needed in order to make the building blocks of our hormones. On the flip side, the gut microbiome also really helps with detoxification of our hormones via liver detoxification is the first step, and then we essentially dump a lot of our hormone metabolites or breakdown products into the gastrointestinal tract, and we rely on the gut to be able to poop them out. So if we don't have a really well-oiled gastrointestinal tract and gut microbiome, we can see that we get upstream effects from that, where we see maybe hormonal imbalances are occurring, but it's as a result of poor absorption of nutrients in the gastrointestinal tract or poor elimination of hormones through the gastrointestinal tract. Does that sound reasonable? Do you have anything to add there?
No, I think that's good.
Okay.
Yeah.
Cool.
Yeah.
Flip side, hormones, right? Hormones mean a lot of different things. We're going to focus in on a few different hormones and categories today, because if we focused on everything, we could talk for hours. But we're going to focus on the female hormones. So female hormones are your estrogen and progesterone, for my ladies out there. And our female hormones are what really govern our menstrual cycle, right? And so these are the hormones that fluctuate throughout the menstrual cycle. And we kind of divide the menstrual cycle into different categories based on where our hormones are at. In our first phase of the menstrual cycle, we consider this to be what's called the follicular phase. And that occurs starting on day 1 of your menstrual cycle. And it can occur all the way up until you ovulate. This usually ovulation occurs around day 14 to 18 for most women who are on a 28 to 32 day menstrual cycle. Okay. With that first piece of the menstrual cycle, the follicular phase, it is all about egg development. So we're trying to build a follicle and egg that will eventually be released at ovulation. With that egg that is being developed is really reliant on estrogen production to be produced appropriately. So our estrogen starts to rise at about day 5 to 7 of our menstrual cycle. It rises to a point just before you ovulate and then actually has a steep decline. That steep decline triggers a hormone called luteinizing hormone to be released, which will trigger the egg to ovulate. Second half of the menstrual cycle is what happens after ovulation has occurred. This is called the luteal phase of the menstrual cycle, and this is all about the lining development. That's the lining that builds in the uterus that if pregnancy doesn't occur, that egg is not fertilized, you will shed that lining, and that is your menstrual cycle that happens monthly. If that egg is fertilized, that lining is where the egg will implant and start to grow. Second half of the menstrual cycle is very progesterone dominant. So progesterone after ovulation will start to rise. Estrogen rises as well. They both rise to their highest about a week before our menstrual cycle. And if symptoms that are happening pre-menstrual, so those PMS symptoms like mood changes, breast tenderness, bloating before a menstrual cycle, if those kind of symptoms are occurring, then that can indicate that there's an imbalance between that estrogen and progesterone secretion. Those hormones then drop significantly, and that decrease of the hormones is what triggers a menstrual cycle to occur. And then we start this lovely process again the following month. That's the female piece of hormone regulation. There's also other hormones that we're going to talk about today, including the stress hormone, which is a really important hormone for regulating our overall energy levels throughout the day, our circadian rhythm. This hormone is called cortisol. Probably lots of you have heard of cortisol before. Cortisol can have a significant impact on our gastrointestinal tract and can have an influence on our ability to absorb nutrients appropriately and can affect our gut microbiome, which then can have trickle-down effects to the menstrual cycle as well. Dr. Morrison and I, about a month ago, 2 months ago, I can't remember exactly when this webinar was, but we did a webinar series on the gut microbiome and stress hormone piece. And so I do invite you to go have a listen to that, because we did talk about that quite significantly. But it's good to just understand that that can have a huge impact on stress hormone formation. So making that cortisol from our ability to absorb nutrients through the gut microbiome, and then also can have effect on those female hormones as well. Cool.
Yeah.
So that's menstrual cycle.
Yeah.
Anything else to add on there?
No, I was just going to say, so like, because you work with a lot of people with both digestive issues and female hormone issues, are there common symptoms that really stand out with, like, that people come in and look for that would guide you kind of more to one side or both sides, or picture of both?
It's a great question. So yeah, I mean, they both play off of each other so much. Common signs that there's imbalances in the gut microbiome: bloating, especially bloating after meals. So you feel like you wake up in the morning, your tummy is totally flat. And then as you start eating, you start to notice that your abdomen starts to distend. That is a common sign that there's something growing in that gut microbiome that shouldn't be in there. So whether it's a yeast, bacteria, virus, parasite, we can figure that out through testing, but that is a common sign that there's some kind of imbalance in your gut microbiome. Waxing and waning between either constipation, diarrhea, or both. These are symptoms that overlap a lot with common diagnoses of IBS symptoms. Irritable bowel syndrome, about 60 to 70% of IBS diagnoses are gut microbiome issues that need to be treated. And so investigation to the gut microbiome is really important for something like that. Another common symptom that we might see is pain with digestion, right? Feeling like after I eat, I don't feel great, or I feel very fatigued after eating. Fatigue in general could be a sign of a gut microbiome imbalance. Acne is another thing we might see. Acne that shows up on the skin that's more persistent through a menstrual cycle, that doesn't fluctuate at all with the menstrual cycle. That might be a common sign, right, that we look for the gut microbiome. Things that I would think more about hormones for are symptoms that wax and wane around that menstrual cycle, right? So if there are significant PMS symptoms, really intense mood changes, or acne that starts around that week leading up to a period, changes in energy, bloating around the menstrual cycle, constipation around menstrual cycle is very common when progesterone is its highest. Those are all signs that if those are really just happening at a certain time of the month, that is more hormone related, right? If there's also signs of heavy or painful periods, that's another sign that there could be a hormonal imbalance. What's interesting is that because these two areas overlap so much, right? Because all of our hormones we detoxify in the liver, and then we essentially rely on the gastrointestinal tract to poop them out. If you're not pooping appropriately or regularly, if that system isn't working as optimally as it could, the sign might actually be the hormonal imbalance. Mm-hmm. So I actually often look at these things, both, right? And it's incredibly common for women to have symptoms in both areas, right? Which then indicates looking at both to understand the full picture. Yeah,
totally. And yeah, you mentioned the microbiome test, or looking at the microbiome. So typically we rely on or look at a stool test that looks at all of those organisms that you mentioned, what ratios they are with each other, but it also offers an intestinal health panel that looks at the breakdown and absorption of foods. So like Dr. Smith was saying earlier, that those like molecules and nutrients are so important for the building blocks of hormones. So we can actually see if those are being absorbed, how much inflammation's in the gut. Inflammation plays a huge role in like our cycle being inflammatory itself. If there's already a ton of inflammation in the body, and then you have this natural process of our cycles that's also inflammatory, it can make it look like those symptoms are like flared or heightened, but it's actually due to something else that's coming from the gut or another inflammatory process in the system. And then there's a couple other markers, beta glucuronidase. I don't know if you want to touch a bit more about that.
Yeah, totally.
And how that impacts the hormones.
Yeah, so beta glucuronidase, this is an enzyme that is produced by primarily non-beneficial bacteria in the gastrointestinal tract. So if we have an overgrowth of different bacterial species that should not be in high amounts in the gut, it's common to see an elevation of beta glucuronidase. And beta glucuronidase is an enzyme that takes the estrogen metabolite, which is in a nice little package that you're supposed to move through the gastrointestinal tract and poop out. If that beta glucuronidase is elevated, it essentially breaks that nice little capsule open and allows for the estrogen to be reabsorbed into the bloodstream. And so then we'll see that there are hormonal imbalances that occur because of that, because we're actually not eliminating or getting rid of our estrogen appropriately. And so when that occurs, we may see that there are more signs towards a heavy or painful menstrual cycle, that PMS symptoms, especially breast tenderness, mood changes, are significant leading up to a menstrual cycle. And that's because our body is not doing a great job of getting rid of that hormone efficiently. And so then we're just essentially kind of all the work that your body has done to get rid of the hormone is negated because you're then just reabsorbing it into the bloodstream. So this is a key thing that we assess for in a gut microbiome analysis, is looking at that beta-glucuronidase enzyme. And if it's elevated, there are key strategies and treatments to reduce that. And you can use things like calcium diglucarate is a great option to support keeping that estrogen stable in the gastrointestinal tract so that you poop it out. But at the end of the day, you do have to treat the reason that that beta-glucuronidase is elevated, right? We don't necessarily just want to go on something that's just a Band-Aid for it being elevated. We actually want to treat why it's elevated. And that's where the treatment for balancing that gut microbiome and getting rid of the overgrowths and then repopulating with beneficial bacteria so that long-term you don't have this issue is really beneficial. This is where the whole kind of idea of like root cause comes from, right? We don't want to just treat what's there. We want to figure out why it's actually happening.
Yes, exactly. Yeah. And then did you want to just briefly touch on the Dutch test? So we covered some testing for digestion, and then we can talk about some testing for the hormone side of things.
For sure. So I often use the Dutch test in my practice to assess hormones. And the Dutch test, for what it's looking at, is a dried urine comprehensive hormone analysis. The reason that we look at urine for hormones, especially for women who are pre-menopausal, but we can look at them post-menopausal as well, is that we get to see how the active hormones are being produced, plus how your liver is metabolizing those hormones. So we get to look at the key metabolism pathways to understand, is your body building up or making too much of the hormone, or is it that your metabolism factors in the liver aren't functioning properly? It really helps us target exactly what we should be treating, right? And it changes the way we treat things. If we're seeing that there's buildup in certain metabolites and the body's not efficiently pooping those out, then working on phase 3 of detoxification in the gut is the most important. If we see that the metabolites are low, but you have high amounts of hormone production, then we want to work on liver metabolism, that phase 2 of detoxification. Well, phase 1 and 2, because there's 2 phases in the liver. We essentially have 3 phases of detoxification, and we can look at this on the Dutch to see, does phase 1 metabolism need support? Does phase 2 metabolism need support? And then by looking at the gut, you can understand, does phase 3? And then that way you understand exactly where you should be targeting your treatment so that we're helping to support proper hormone production plus proper hormone breakdown. That's why the Dutch test is so valuable in terms of information, is because we can assess for every hormone, your progesterone, your estrogen, your androgens, which we actually haven't touched on yet, but that's testosterone and DHEA, which for us as women are very important hormones for our overall mood regulation, motivation, libido, sex drive, ability to build muscle in the gym, as well as assessing the stress hormone. Another benefit of dried urine testing is that we can test it multiple times throughout the day. So we can build what's called a cortisol curve, and we can understand how cortisol is being secreted throughout the entire day. Cortisol should naturally rise in the morning to get us up and then slowly decrease throughout the day, nice and low at night so that we can fall asleep. With this, when we assess it 4 times throughout the day, we can build that rise fall, and we can see, is that appropriately happening for you, or is that an area that needs to be treated? And that's incredibly common for something that we do look to support, right? And something that we often see on testing. I think both of us have seen that many a times on the Dutch, that's really an area for focus. And what's interesting with that is that if we're under a lot of stress, our bodies will preferentially make our stress hormone because we're busy running away from a bear, right? And who cares about our female hormones and those hormones associated with making a baby if we're like running for our lives, right? And so with an assessment or a comprehensive assessment of hormones, then we can understand, the stress hormone picture, and is that having an influence on our female hormone production, or does it look like a well-regulated system and this has more to do with detoxification parameters, right? With insights like this, it allows for really targeted and specific treatment.
Yeah.
Yeah.
Do you find, like, I know you use the Dutch also for like perimenopause and menopause, and I imagine that gut plays a big role with those, actually, like with that transition as well.
Totally. Yeah. So yes, this is where in perimenopause, hormones are quite erratic in nature. I will still use the Dutch test to analyze hormones, but we have to understand that it's a snapshot, right? So any hormone testing really is a snapshot, but with the erratic nature of the hormone fluctuations that occur in perimenopause, it can change quite rapidly, right? So we may see that there's elevated estrogens for a period of time, and then there's low estrogen later on, right? As we're kind of on that perimenopause journey. But assessing the proper metabolism of the hormones, assessing the stress hormone picture to understand, do you break down your hormones properly, or is this an area that needs to be supported? And is stress hormone playing a part in the symptoms that we often blame on perimenopause? We're really quick at perimenopause time to just say this is all estrogen and progesterone, and the stress hormone has nothing to do with this. And that is not always the case. Hot flashes can be caused by stress hormone dysregulation. Inability to sleep can be caused by stress hormone dysregulation. Changes in mood, more tendency towards anxiety or depression can be caused by stress hormone dysregulation. And so I find it very valuable to assess both areas so that we know, okay, if this truly is just perimenopause, let's go support that. But if we're missing a whole area worth treating, we should look to treat that too, right? And treating them in balance with each other really does allow for more of that balance and smoother transition as we move to menopause. Right?
Yeah.
Similarly with menopause, yes, we will often see that there is low hormone production, as we should in menopause, unless a patient is on an HRT, hormone replacement therapy. But we still get great insights around, is there any stress hormone involvement when we look at a Dutch, or is there any concern with the way that you break down your hormones, right? And that detoxification pathway still does matter, because the small production that is happening has to still be detoxified, right? Phase 3 of that is looking at phase 3 of detoxification, which is the gut microbiome. And the gut microbiome assessment in menopause and perimenopause is equally as valuable as premenopause, really any time of life, especially if you have symptoms in your gut microbiome. So the bloating, constipation, diarrhea, or pain after eating, not feeling great after eating, are all signs that this should be assessed. But this is another area to look at, the beta-glucuronidase. So this enzyme comes up in a different way in perimenopause and menopause. If that enzyme is super, super low, so not super high where it's causing that estrogen reabsorption, which is too much, but if it's too low in perimenopause and menopause, we are getting zero estrogen reabsorption in our gut. And that can lead to more intense hot flashes, brain fog, mood changes, joint pain, weight gain. There are so many different symptoms associated with low estrogen. So it's really about that balance, right? If there's overgrowths in the gut and that beta-glucuronidase is way too high, that's not great. But if it's way too low, we get zero estrogen reabsorption at all in the gut. And that can affect your overall hormones in perimenopause and menopause, right? So it's a different way to assess it. And when there's a very, very low, less than detectable beta-glucuronidase, it is often a sign that you don't have enough bacteria in your gastrointestinal tract. You have a low amount of a beneficial bacteria profile. And when that occurs, that can lead to a lot of gastrointestinal symptoms on its own, right? It's not always the overgrowth, right?
Yes.
Sometimes it's that there is no overgrowth, but there's actually not enough beneficial bacteria to help you break down your food properly, to allow for proper absorption of those nutrients, which are so important for hormones, right? To allow for proper detoxification.
Yeah. In common with like more of the low microbiome, that people who do treatments that are targeted at the microbiome, or like SIBO treatment, SIBO, whether it's at home, cleanses, they actually will feel worse from treatments. And it's actually because we're just continuing to lower the good species in there, and they don't have as much robust or diversity in there to help with everything coming in. So it's very common to see that the standard protocol that should work kind of across the board or within a realm, just we're not having the same response, or is actually making people feel worse.
Yeah. And I think that kind of pieces together another reason that looking at testing for this is so helpful and beneficial, right? Because sometimes you are expecting to see an overgrowth because the symptoms line up with those overgrowth symptoms, but it actually is not enough beneficial bacteria. And so then that's the area that you target moving forward, right? And when we're targeted with our treatments, we often see that there's benefit there.
And when there is a low overgrowth, actually nutritional factors and foods can be very helpful with that. So kind of our big groups that we go to, fiber, that we really encourage people to slowly incorporate. Of course, if you go 0 to 100, you're going to trigger a lot of those symptoms anyways. But fiber is going to be a big player, and a diverse like groups of different fibers is really going to be important. Having that diversity and getting those different molecules in is going to feed different types of bacteria, different species of yeast in the gut. And the more diverse that microbiome can be, the better health outcomes it is across the board for every condition. So if we can start, even if it's really little, even if it's like 1/8 of a teaspoon of chia seeds, if that's what our system can tolerate, that's where we want to start. And then slowly incorporating more and more fiber, up to 25, 35 grams a day, depending on body size. Another one is going to be fermented foods. So any like sauerkraut, kimchi, miso tempeh, same thing with those. We want to start at a little bit, kind of like 1/8 of a teaspoon, and work our way up to a couple tablespoons a day. That can be a really powerful food to incorporate for people to feel really good and increase the diversity in the gut. The other two that are really powerful can be polyphenols, which are going to be the colors in cherries, like berries. It's in some dark chocolate, it's in some teas. And so that rich color is going to feed specific species in the digestive system, which in turn will help other species to grow and be more diverse. And then resistant starch, which is going to be a carbohydrate that is cooked and then cooled, and then you can eat it cooked again or cooled if you want, like you can reheat it. But just that cooking and cooling, that first change in that structure is going to create a resistant starch that is really powerful to feed the microbiome. And so I always just let people know to be really mindful with these. If we're triggering symptoms, then we might be going too much too quickly, and we just want to slow it down or change the diversity in the diet. And then if we're really kind of hitting a wall with these and the digestive system's not changing, then we can again go back and look at testing or looking at doing it through more supplementations or probiotics that will help to support the microbiome to start until we can tolerate some of those foods. Was there any there that you wanted to add from the food perspective, or any nutrition that would be beneficial from a hormone perspective as well?
Yeah, that's a great question. So I mean, fiber is so important, right? Those are kind of our key like top things that we add in, right? And like Dr. Morrison said, kind of go slow and incorporate some of the recommendations for more of helping to support hormone health and building of hormones plus detoxification of hormones do have a lot to do with fiber. And so again, like if you're not tolerating these, if they're causing symptoms like bloating, that's a good sign that we need to assess the gut microbiome. With these things like cruciferous vegetables, especially when they're cooked, cruciferous vegetables include broccoli, cauliflower, Brussels sprouts, kale, cabbage. Not only are they a great fiber for the gastrointestinal tract gut microbiome makeup, but they also help with key detoxification of your estrogen and testosterone through the liver, because they're really rich in a compound called indole-3 carbinol. Indole-3 carbinol will convert to something called DIM in the body, and that will promote detoxification of the estrogen and testosterone, so that your body can naturally get rid of those hormones. Leafy greens in the diet every day. So take something different every day. Spinach, kale, mixed greens, arugula. The more you switch it up, the more you're feeding a different diverse profile of bacteria in your gastrointestinal tract, but also you're helping to support that detoxification of your hormones as well. Seed cycling can be really beneficial. This is more so for women who are pre-menopausal. In perimenopause, this can be efficient as well. But essentially in that first phase of the menstrual cycle, follicular phase that we talked about at the beginning, estrogen dominant part of the menstrual cycle, we want to add in things that are helping to support estrogen production. 1 tablespoon of flaxseed, 1 tablespoon, ground flaxseed, 1 tablespoon of pumpkin seeds. After ovulation, which for most women occurs between about day 14 to day 18 of their menstrual cycle, if you're tracking your menstrual cycle, ovulation occurs 2 weeks before your next period. So up until that ovulation occurs, and you may notice around ovulation something called ovulatory discharge, where you see a cervical mucus production or vaginal discharge that's sticky egg white in nature. It often has a slippery effect. Like when you go to the washroom and you use toilet paper, there's kind of a slipping sensation. That's a key sign that that's your ovulation that's occurred. After ovulation, you switch over to seeds that help to support the luteal phase progesterone production. And that's 1 tablespoon of sesame seeds, 1 tablespoon of sunflower seeds. Those can be really beneficial at helping just to regulate a menstrual cycle. For women that it works for, it is incredibly powerful.
Yeah.
For women that it doesn't work for, we notice no change. I would say it's either like really great
Yes.
or
Yeah.
you don't see a change with it. It's kind of interesting, but I have had people say that completely changed
Yes.
every symptom around a menstrual cycle, and then for some it's not the right fit, so we try something else. Another thing, eating breakfast with protein is so important for your hormone production via the stress hormone regulation that occurs. Plus, protein is a key building block for your estrogen and progesterone. So aim for 20 grams of protein. This is pretty easily met with most breakfast foods. Smoothies are a great option if you have a cleaned protein powder. Usually 1 scoop is 20 grams of protein, which is what we're aiming for. And we want to have breakfast before 10 a.m. at the latest, usually within the first 2 hours of waking, if possible. And that will help with your stress hormone regulation, as well as providing that building block for your menstrual cycle hormones. There's also options like Greek yogurt. Oats are a great option. If you cook and cool your oats, you get that resistant starch that Dr. Morrison was talking about earlier, which is so beneficial for your gastrointestinal tract. Eggs, omelets, all that kind of stuff have really good amounts of protein in them. And then the nuts and seeds that we just talked about, even with seed cycling, those have protein. So add them to your breakfast, and then you're easily getting that 20 grams that we're looking for. And that's something I do recommend that we do every single day. It will help overall with hormone production. Generally in the second half of the menstrual cycle as well, with progesterone we'll often see in the second half of the menstrual cycle, lots of women have cravings. Like, I need chocolate before my period, right? And that is generally because progesterone actually prefers for proper production to have a little bit higher glycemic index foods. Okay, so we don't necessarily need to like only eat chocolate for something like this. Not that 1 or 2 pieces of dark chocolate is a bad thing. But if we have more complex carbohydrates in the second half of our menstrual cycle, things like cooked and cooled potatoes, which is another resistant starch that's super beneficial for your bacteria in your gastrointestinal tract, but is also an awesome complex carbohydrate for helping to support your progesterone production. Add that with your meal. If you're not often eating any kind of carbohydrates, that's actually probably depleting some of your progesterone production. So in the second half of the menstrual cycle, add those things in, some brown rice with dinner, adding in within your kind of like vegetable profile that you have some more of those starchy things, carrots, beets, potatoes that we already talked about. Those are all really great add-ins in second half of your menstrual cycle to support that production of progesterone, which will help with mitigating symptoms around PMS as well as symptoms when you're on your menstrual cycle.
Yeah.
So it's all about kind of achieving that balance between estrogen and progesterone.
Yes.
Yeah.
Yeah.
And then those are also all good add-ins for supporting the gut, which will then help support the proper breakdown and detoxification of those hormones naturally.
Yeah.
Yeah.
Yeah. There is, I talk a lot about seed cycling as well. And so if no one's tried or does want to try it, there's a ton of recipes online that, that can just be looked up if you do seed cycling, like protein balls or anything. If you do like baking, but that's always a good way that you can like batch prep them.
Totally.
Say like if it's like a protein ball that you make with all of those in it, throw them in the freezer. You kind of have them for the 14 days and 14 days or whatever that cycle length is. But that's always a good way just to have them kind of in your back pocket if it's not as easy to throw them in your breakfast or smoothie. That's a really great way to have it.
Yeah.
But if you do like baking or that side of things, that can always be a good way to add that in.
For sure.
Yeah. And is there, from a protein perspective, you talked about breakfast, but do you like people to eat protein later in the day as well? Is there kind of like a target that you want them to reach for that?
Totally. For optimal hormone health, again, kind of depending on activity levels and all that kind of stuff, but we aim for about 1.2 to 1.6 grams of protein per kilogram of body weight a day. And for most women, we're kind of hitting in the 70 to 90 grams a day range, and that fluctuates based on body weight, of course, right? But that is kind of the ideal amount of protein to have the building blocks necessary, right, to then build our hormones appropriately. Because if we're deficient, then we often see that our hormones don't get made properly, and we may see symptoms even to the point where women will lose their menstrual cycle or their menstrual cycle is not as regular. So with that, kind of making sure that you're getting protein with breakfast, yes, but then lunch and dinner, 3 kind of bigger meals, right? And then maybe snacks throughout the day, depending on appetite, right? But that's kind of what we aim for, is having a really kind of well-rounded amount of protein daily. And whether that's coming from animal or vegetarian sources, those are the kind of numbers that we want to hit. Generally with vegetarian sources, that does mean you're eating quite a bit of those vegetarian sources to hit that, but it's totally doable.
Totally. It is doable.
And it's a key piece that I see often in my practice where there is more of that kind of protein deficiency, that the symptoms don't happen right away, right? We don't necessarily see that the minute you stopped eating breakfast, your menstrual cycle suddenly changed. It's kind of a slow build, right? Over time, 6 months down the line, right, we start to see these irregularities start to happen, right? And it can all be kind of like tied back to the fact that, oh yeah, we're actually protein deficient right now. Right. Healthy fats are another huge piece of this. Those are really key for building hormones appropriately. When we say healthy fats, avocados, walnuts, those nuts and seeds that we talked about within seed cycling are a great option. Cold water fish like wild caught salmon, sardines, mackerel, if you enjoy those are amazing add-ins to get that healthy fat through the diet that then helps with building those hormones.
And having like enough fat in your diet can really help with from a bowel movement perspective. And fat and protein, like you alluded to earlier, if we're not having enough of those nutrients, it's just another stressor on the body. So then it's going to impact our cortisol and our stress response. And then that also, as you mentioned, slowly over time is typically how we notice that. And it's just like more things in our stress basket that, you know, like not enough protein for a month might not be enough to do anything, but not enough protein, not enough fat, not enough movement, not enough exercise, a stressful event, and now our cycle and our digestion are thrown off, and it's now we kind of have to like pick these pieces back up to align everything again there.
Totally. Yeah. Another thing I'd love to touch on quickly that we haven't really talked about is some of the inflammation pieces that can come with having inflammation in the gastrointestinal tract, and key kind of hormonal conditions like endometriosis, fibroids, PCOS, right? These are very common things that we see from a female hormone perspective, and we often kind of narrow in and look at the hormone picture alone for something like that, right? And more commonly than not, we see high amounts of estrogen, right? And low progesterone and things like that that make the symptoms worse, right? And that can be being contributed to or driven by the gut microbiome. It is very common with things like endometriosis, fibroids, PCOS, that we see overgrowth of non-beneficial bacteria or yeasts in the gut that are affecting the hormone regulation in those conditions, but are also increasing inflammation in the body, which then makes those inflammatory conditions that much worse, right? And so it's something I do assess in all of my patients with those key conditions, is that we look at the gut microbiome and we get that machine really well oiled and working properly, and that will inherently help with those as well, right? Because they are so overlapping and connecting based on everything we've talked about so far, right? That absorption of the nutrients for building the hormones, but also the detoxification pathways, right? And if we're allowing that constant buildup of estrogen, then that can lead to worsening of the fibroids or endometriosis tissue that's being built, right? Anything to add there?
I was just gonna say, even like from a PCOS perspective, our microbiome has so much impact on how quickly we'll absorb sugar and carbohydrates from what we're eating. And so if there's already blood sugar imbalance or dysregulation and insulin and the whole PCOS picture, and there is an imbalance in our microbiome and we are absorbing it more quickly, just addressing that gut picture can really help with the downstream effects. And then we don't have to kind of work so hard and stay in this parameter of things. If it's actually just more of an absorption issue, it can help on that front as well.
Totally. Yeah. I just read a research article today about blood sugar regulation, more from type 2 diabetes, which is still relevant for PCOS, right? Where we often see an insulin resistance picture, where higher amounts of choline dietarily in the diet, which often comes from meats and beans like fava beans, as well as eggs, is where we primarily get our choline. But it helps to increase something called TMA in the gastrointestinal tract, which helps with insulin regulation, right? And so there are huge benefits to optimizing gut health for all of these different areas, right? That research was focusing more on type 2 diabetes specifically, but from an insulin resistance picture, it makes sense that you would also want to support that for just general health, right? And so big takeaways, I feel like, from this whole conversation, right, is really focusing in on how are we feeding our gut microbiome. And then if you know there's already imbalances in your gut microbiome and just these dietary add-ins of feeding your gut microbiome aren't making a difference, that might be a reason for having an assessment done so that it can be treated appropriately, and then we can establish that, right? So that long-term we see benefit within the gut.
Like these, and with the nutrition parameters, we typically see like a really great starting point. Like this is where people can start. These are things you can implement right away. And if they work, fantastic. And if they don't work, having that assessment, but then actually still having these tools more long-term, because once we can get that microbiome rebalanced and established, then we do want to incorporate these foods again, so that that diversity is going to stick around long-term, and we're going to prevent any of these overgrowths from coming back. So whether we're we do want to start there, but we're starting and almost finishing in the same place when we
Yeah.
do these treatments. And then kind of that gray area in between of what else might be going on if there is something else going on. But they're either going to move the needle a lot to start, or they're going to be one of the things that are huge from a prevention aspect.
Absolutely. Yeah. These are the things, right, that we do for foundational treatments, which I think both of us have similar kind of treatment styles where if there's an imbalance, then yes, we often do need some kind of targeted treatment, right, to correct that.
Yeah.
But our goal is never that we just put you on a bunch of protocols and you just take these things forever, right? It's more so trying to achieve that balance in the body and then allowing diet lifestyle to take over long term, right? That's always the goal that we're trying to get back to.
Yeah.
And so if you can start and those diet lifestyle things work, great, awesome, right? But it's not to say that targeted treatment means you're on a protocol forever. It's more so we treat. And for gut microbiome, I would say those treatments anywhere from 3 to 6 months total is usually kind of the timeline that we're looking at. And then we want to let that diet lifestyle take over. Right. And I mean, if some of those symptoms are persisting, then that is an indication to figure out why. There might be another reason, right? And this is where maybe inflammation, chronic inflammatory response syndrome that Dr. Morrison works a lot with, may come into play as other contributing factors to symptoms.
And a big thing with diet as well, a lot of like when there is a digestive imbalance, it's really easy to get quite focused on eliminating more and more and more foods. And so always to keep in mind that long-term goal is to incorporate all those foods that we mentioned, protein, fats, fiber, polyphenols, that we want to continue to have more and more diversity in the diet. So if we're narrowing and narrowing and narrowing, we already know that there's some imbalance, whether that be the microbiome, whether that be more of that chronic inflammatory response syndrome, which can be triggered by things like mold exposure, or Lyme disease, or viral infections, root canals, food poisoning. Food poisoning is a huge one that we work with. And so there could be something else going on that's triggering an inflammatory cascade that's disrupting the microbiome, that then is also in turn infecting female hormones, whether that be cycle regulation, whether that be menopause, and making those inflammatory responses in the body, which are normal, just worse because there's just too much stress in the system all at once. So yeah, I always just like to have that conversation of like, the goal is to incorporate as many foods and groups of foods as possible. So if we're narrowing down, we've got to figure out why, and we've missed something, and we got to be able to expand that.
I think something we also commonly see nowadays is quite a few kind of like carnivore diet, because when there's no fiber in the diet, if you have a gut microbiome imbalance or you don't have enough beneficial bacteria, people feel good on that, right? But it starves all of your beneficial bacteria because there's no fiber there. And so then there is kind of a process of rebuilding. It can still be achieved, right? We can get fibers back into the diet. It's just kind of a slow reintro, right? And potentially targeted probiotics for that too.
Similar to that, when people come in and they'll do like intermittent fasting, and they'll won't eat till 12 or 2, but the reason they're actually not eating till 12 or 2 is because when they eat breakfast they feel bloated, and then they don't feel good all day and their energy suffers. And so it's a symptom management approach, which is great. We have that in our back pocket to utilize, but again, it's just a sign that something else is deeper is going on, and we can actually look at that and we can work with it. And it's not that intermittent fasting is bad. We love intermittent fasting. I would just rather you shift it to an earlier time frame, and then you can fast at night. And so we can utilize it, but when we're doing it because we're trying to avoid symptoms, it's just that sign that something else deeper is going on.
Totally. Okay, we have 10 minutes left in the talk. If you guys have questions, feel free to drop them in the chat.
Yeah, it's good to see you both.
It's great to see you.
Yeah, I was just wondering, because I was told that I might have a low histamine threshold, and all of these great foods that I love, avocados and all these things, are actually not helpful for the histamine level. And so I wonder if you have any tips on how to utilize those foods while also not hitting that threshold?
That is a great question. And our colleague, Dr. Best, who works with a lot of histamine regulation concerns, he just did a webinar, Crystal, on mast cell and histamine regulation
And foods.
and foods. So I'd highly recommend watching that. That should have been sent out to you
Okay.
for that. With this, what I would say is, like, you start with one, and then if your body tolerates that, then you try to incorporate another, rather than going 0 to 100, which we know with histamine, that often will cause the symptoms to kind of like overwhelm the body, right? So I would pick, like, don't pick fermented foods maybe as your first one, because those tend to be higher in histamine than just fibers from vegetables. But pick one and then build from there as you can. Well, yeah, it's tough to say which one to start with.
Yeah, I would say too with that, like having that lower threshold with histamine, if we like kind of getting underneath that of, okay, there actually can be certain species in the gut from a test that we can see that they will like produce more histamine in and of itself.
Mhm.
And so if we see that in a microbiome test, okay, we can target and treat those species to bring them down, which actually will lower that histamine level in the system.
Mhm.
And then there are certain, I guess backing up for that too, like what else potentially is kind of in that background that has lowered that histamine
Mhm.
tolerance there, but then we can introduce things in the meantime if it does help, that help with the breakdown of histamine, that stabilize those mast cells. But I do think from a diet perspective, like, yeah, Dr. Best's webinar would probably be the best
Yeah.
referral to dive a little bit more deep into that.
And
Yeah.
it, Melissa just put that in the chat,
perfect.
Crystal, for you. You've got the link there so that you can find
Okay.
that webinar. Okay,
Can you see that?
Okay. Yeah, I do. Thank you so much.
no worries. What is the amount of protein per kilogram per day? 1.2 to 1.6 grams per kilogram of body weight. And I'll just pop that in the chat too. Is seed cycling good for full menopausal women as well? Eating those seeds to help support your estrogen and progesterone, yes. You don't need to seed cycle them if you don't have a menstrual cycle anymore, because you're no longer having the fluctuation of estrogen and progesterone like you did when you had a menstrual cycle. So just incorporating them in the diet, those seeds, they are what are called phytoestrogens and phytoprogestogens, helping to support binding the estrogen and progesterone receptors that are now sitting essentially empty because there's no more estrogen and progesterone production. So you can just eat all of the seeds daily, or you can pick a few and you can swap them day to day if you don't want to eat a tablespoon of each a day, which I totally understand. But if you had one every day and you just cycled through the 4, that would be super, super great to help support, again, that estrogen and progesterone production daily rather than through the cycle, which you would do before you go into menopause. Cool. Any other questions from you guys? Those were really good questions so far. That's a great question.
Yeah.
Susan, is rheumatoid arthritis affected by the gut microbiome? Yes, if there's inflammation in the gut microbiome as a result of overgrowths in the gastrointestinal tract, for example, or not enough beneficial bacteria, so we're not producing a key nutrient called butyrate in the gut, which helps to lower inflammation, that can create inflammation systemically, which can contribute to rheumatoid arthritis, which is an inflammatory process. And so we can also sometimes see something called leaky gut, which we didn't get into today, but essentially leaky gut is where if there's inflammation in the gastrointestinal tract, the small cells that line the entire gastrointestinal tract are no longer sitting super tightly together. They're actually sitting a bit disjointed. And that allows for larger food particles to pass through the gut rather than having to go through the cell. And so with this process, that can create inflammation, which can then lead to a more inflammatory process within increasing essentially inflammation in the joints associated with rheumatoid arthritis. We'll often again see that there are signs of gut microbiome imbalances if that's something that needs to be assessed. So if you have symptoms in the gastrointestinal tract, then that's worth investigating and treating.
Yeah. And with the microbiome testing that we do at the end of the report, there'll be like kind of retrospective studies that they'll have the certain species that are too high or too low, and they'll just have a correlation. So it's not a causation, meaning if you have this species, it doesn't mean you're going to get this condition. But yeah, rheumatoid arthritis will pop up there of like, okay, we've taken a group of people with rheumatoid arthritis and we've done these microbiome tests with them, and these are the species that are typically higher in those people with the condition. So we're just correlating it. We don't know if it's a causation, but it's just something that we have seen. And so yeah, it can be super helpful with treating those species, as Dr. Smith said, that are driving that inflammatory cascade.
Totally. Okay, how do you feel about probiotics in reducing gut inflammation and also stabilizing our female hormones? Better to consume from food or okay in capsule form? Do probiotics help increase fertility chances? Do you know indirectly? Great question. So if there are low beneficial bacteria in the gastrointestinal tract, then probiotics can be extremely helpful, right? And so if there's inflammation in the gut because we don't have a well-established microbiome, then yes, that is a good option. Because our gut microbiome essentially helps to support the proper breakdown of our foods so that we absorb those nutrients to build our female hormones appropriately, then yes, they can have an effect on the ability to make our female hormones. And then also because they have an effect on the breakdown and getting rid of our female hormones, if there are low beneficial bacteria that are affecting our ability to poop, for example, we have more of a constipation picture, so we're not eliminating our hormones as effectively as a result of that, then that could have a correlation. And so then using a probiotic in that case can be beneficial. In terms of probiotics increasing fertility chances, there's no direct causations showing that probiotics equals increase in fertility. But again, if you're working to support the overall gut microbiome, which can then help to support the overall female hormone picture, then yes, indirectly, they could potentially help. I think that would require a bit further investigation to know whether or not that is the best option, or if there's something else that would be better for fertility support and supporting female hormone production and stabilization. I have had IBS-D for 20 years and my life was turned around when my GI doc gave me amitriptyline. Gotcha. That is a common medication that's being used for IBS and can be very, very helpful, which that's awesome that that's working for you, Lisa. That's fantastic. And yeah, if you don't have those IBS symptoms anymore, that's really, really awesome, because they're not great to have to deal with. And with a 20-year history, that's fantastic that that medication is working for you. Cool. Well, we're at 8 o'clock, you guys. Thank you so much for joining this meeting. It was great to have you all here. We hope you guys got some beneficial information out of it, and we'll catch you on the next webinar.